that's what we'll be discussing. Here, we cover a wide range of topics, including sexual education, bladder health, and much more. If you enjoy what you see, don't forget to subscribe and tell your friends about this channel. It's crucial that you comprehend the process by which an erection occurs before we begin using these medications to treat erectile dysfunction. Arousal is the first step in this process. Whenever you perceive anything by sight, smell, hearing, or touch, your body releases a substance called nitric oxide as a result of being aroused, and nitric oxide it functions as the ignition for erections. Arousal and nitric oxide are necessary for erection induction. As a result, your body starts to produce hormones once you have nitric oxide and arousal. There are various chemical messengers, and one of them is cyclic guanosine monophosphate, or CGMP. The smooth muscles in the penis relax as these messengers are released. Additionally, the penis's veins obstruct, preventing blood flow. What prevents the erection after the blood goes back into the penis and causes a strong erection? There are three main issues, though. Nitric oxide, or the arousal stimulation, disappears first. The second is that your body eventually reacts nervously. Your neurological system therefore activates during ejaculation, resulting in those smooth. As a result of the muscle's contraction, the blood is forced from the penis into the rest of the body. Your penis will become flaccid as a result of all of these erectile dysfunction drugs because they all treat erectile dysfunction. Before I explain the differences between sildenafil and Tadalafil or Viagra and Cialis, I want you to be aware of some common side effects, such as headaches, flushing nasal congestion, heartburn, and, on rare occasions, vision changes. They work by blocking the breakdown of that chemical messenger CGMP. Additionally, there is one prescription that you must never take. These drugs are referred to as nitrate drugs or drugs that contain nitrate. People with angina or chest pain frequently receive nitroglycerin prescriptions. Usually, a tablet is administered to them. If your chest pain is ongoing, you should. You cannot use any of these erectile dysfunction drugs if you are on that medication. The rationale is that taking both of these at once may cause your blood pressure to decrease. Additionally, some medications have risks that are so low that you might really be at risk of passing away or dying. Can result in drug interactions, and if you have renal or liver issues, you may need to adjust the dosage of the medications you're taking, so it's important to get things checked out. You may find some over-the-counter supplements when treated by a doctor. In spite of, these medications shouldn't be present in them, and those that do are harmful. There are a few extremely rare but dangerous side effects with these medications, so you need to be careful not to take too much or too little of them. The term priapism refers to one of these, which is an erection that lasts longer than 4 hours. And having an erection that lasts longer than 4 hours is actually not a good thing. It actually begins harming the tissues of the penis, harm that may be irreparable. In a video I made in response to Grey's Anatomy, I discussed priapism and how it can be dangerous if not treated soon away. Fortunately, with these drugs, this is incredibly rare. Especially when taken appropriately. When someone overdoses on these is the only time we actually notice it. The other uncommon adverse effect is that you may experience this issue if you take too many drugs. Hearing loss may be risky. Although it has been mentioned as a very rare but dangerous adverse effect, I have never experienced that in my career. Both of these drugs have a success rate between 60 and 80%. In terms of effectiveness, they are almost equal, so why am I talking about them? They are the least expensive options for treating erectile dysfunction because they are both equally effective, at least in the United States. In terms of sildenafil, these two are the ones I prefer to recommend the most. The genesis tale. The history of how sildenafil was developed is actually quite fascinating. It was initially developed as a medication for high blood pressure, so researchers tested it on patients to see whether it would lower their blood pressure. However, they discovered that it had no effect on blood pressure. Sildenafil is the oldest drug now on the market, but in actuality, users began seeing firmer, stronger erections. Because it contains the most information on its effectiveness and use, taking Viagra, take it on an empty stomach and about 30 to 60 minutes before sexual activity. Before using Viagra, consuming a lot of high-fat foods will decrease the medication's effectiveness. Since it will stay in the stomach longer if taken on an empty stomach, it is ideal to do so. There are several dose options available, the lowest of which is 25 milligrams. You can only take it before having sexual relations because it is only accessible in what is known as on-demand dosage. You cannot use it every day. That won't happen. Instead, the following are some negative effects that are exclusive to Viagra. When taking Viagra, some persons experience what is known as blue-green discoloration or changes in their color vision. If that occurs, you must immediately stop being vigorous and consult a physician. Another adverse effect that occasionally occurs with Viagra but not with Tadalafil is nose bleeding. Tadalafil is a more selective parade inhibitor, however it only occurs in a tiny portion of people. In other words, it more selectively blocks the erection-causing enzymes. We don't have as much information on Tadalafil as we have on Sildenafil because it was only released in 2003. It can be taken on an empty stomach, however it should be taken 30 to 60 minutes before sexual activity. Your bloodstream retains it for up to 36 hours. Therefore, if you wish to engage in several acts of sexual activity on a weekend, this medicine is a great choice for you. You can buy it and take a low dose of it as well. Some individuals enjoy that because they enjoy the element of spontaneity that it. Take one pill daily, and you'll be able to engage in sexual activity whenever you choose. You may observe that the on-demand dosing ranges from 5 mg to 20 mg, which is lower than the Sildenafil dosage. The other intriguing aspect of low-dose daily Tadalafil is that it is also beneficial for men who have benign prostatic hyperplasia or BPH. This does not imply that it is any less effective. You can view my video regarding bipolar disorder. I previously tried to learn more about that, but what it does is assist men with urinary symptoms of BPH, specifically difficulty emptying your bladder and straining to wake up in the middle of the night to urinate, possibly having some urgency, gotta go, or urinary frequency. So if you discover that you have urinary symptoms associated with BPH and erectile dysfunction, you should take action. Well, you might be able to get away with taking only one drug to treat both issues. Lastly, research indicate that men with total erectile dysfunction may benefit from. Which drug is best for men who have no erections at all? Tadalafil may be more effective than other drugs for these individuals. I'll now offer some information I discovered comparing Sildenafil and Tadalafil. If you're new here, you should know that I enjoy looking at meta-analyses. For the meta-analysis, these studies provide a systematic review of all information that has been published on a certain subject. In other words, they analyze the precise data from all of the research and integrate it, which results in a much stronger study, allowing you to argue things like, since this is what 10, 15, or 20 studies concluded, it must be more accurate than just one study alone. Specifically, meta-analysis and systematic reviews. I compared Sildenafil and Tadalafil and looked for. In every trial that pitted them against one another, they were required to fill out a certain validated questionnaire. When they had to compare the results of their erectile dysfunction, they couldn't simply state, "Hey, did you have erections?" They have to utilize a questionnaire that has been examined and validated to measure the difference. In this study, the results of treating erectile dysfunction showed a clinically significant difference. They specifically examined 16 trials with almost 5,000 individuals, and what they discovered was. As for effectiveness, it was roughly the same in both groups, as I previously said, but in this case they also looked at the patient's treatment satisfaction and adherence, or adhering to the drug or using it frequently with either Sildenafil or Vardenafil, were deemed by the partner to be equally as important. In these research, those who embraced Tadalafil exhibited higher levels of self-esteem. They reported higher levels of treatment satisfaction in their relationships, and preference was examined in 9 research. In 9 of these trials, they questioned them about their preferences. What they discovered, then, was that Tadalafil was preferred to Sildenafil by both the men and their partners. Both groups saw a same level of persistence and adverse effects. The only variation, adverse effects. It was discovered that patients taking Sildenafil were more likely than those taking Tadalafil to experience vision changes. What should I advise because they were more likely to experience muscle pain? So, if you experience urinary symptoms while if you have BPH and are prepared to take an as-needed medicine, I advise taking 1 mg of Tadalafil daily. Try either one, and if it doesn't work, switch to the other one. But make sure you're always doing this under a doctor's supervision. If you're interested in learning more about some alternative treatments for erectile dysfunction, outside pharmaceuticals, leave a comment and I'll make movies about these as well. These include urethral suppositories, intracavernosal injections, vacuum erection devices, and penile implants. I have produced a few videos on penile implants. You can also check those out, and as always, keep in mind that you should look after yourself since you are worth it.